Ever wondered what causes congestive heart failure? It's a condition where the heart can't pump blood as effectively as it should. This inability leads to fluid buildup in your body, creating a domino effect of health issues. You might find yourself short of breath, constantly fatigued, or notice swelling in your legs, ankles, and feet. It's a situation that can seem quite daunting. It sounds scary, doesn't it? But don't worry, we'll dive deeper to understand this better. The heart is like the body's engine, pumping blood to all parts, but what happens when it fails? Picture the heart as the body's delivery service, tirelessly transporting oxygen and nutrients to every cell, every nook and cranny of our body. This round-the-clock duty keeps us ticking, keeps us alive. But sometimes, this diligent engine stumbles. When we say the heart fails, it doesn't mean it halts, stops beating, or gives up entirely. No, it's not as dramatic as that. Instead, it means that the heart just can't pump blood as efficiently as it should. It's like a delivery truck that's lost its horsepower, struggling to keep up with the demands of its route. As a result, the body doesn't get the oxygen and nutrients it needs, leading to feelings of fatigue and shortness of breath. It's like running on an empty tank, gasping for fuel. So, what causes the heart to fail in its duty? Let's explore. Many factors can lead to congestive heart failure. Let's dig into some of the major ones. First up, we have coronary artery disease. This is a condition where the arteries supplying blood to the heart muscle become narrow or blocked due to plaque buildup. This can starve the heart of the oxygen and nutrients it needs to function properly, leading to damage and, over time, heart failure. Next, we have high blood pressure or hypertension. When your blood pressure is continuously high, your heart has to work harder to pump blood. This extra strain can weaken the heart muscle over time and cause it to fail. A previous heart attack can also be a major cause. When a heart attack occurs, part of the heart muscle is damaged or dies due to a lack of blood supply. This damage can weaken the heart, making it less efficient at pumping blood and potentially leading to heart failure. Diabetes is another significant factor. High blood sugar levels can damage blood vessels and nerves that control your heart, contributing to heart failure. Lastly, certain medications can also lead to heart failure. These include non-steroidal anti-inflammatory drugs, certain diabetes medications, and some chemotherapy drugs. These drugs can either make the heart work harder or directly damage the heart muscle. Remember, these conditions don't always mean heart failure is inevitable, but they do increase the risk, making the heart work harder, which over time can weaken it and lead to heart failure. Now, how can we tell if someone is suffering from congestive heart failure? Let's find out. Congestive heart failure may creep up slowly, but it does send signals. Here's what to look out for. The most common symptoms include shortness of breath and fatigue. You may find yourself gasping for air after a simple task like climbing stairs, or feel worn out much quicker than usual. Another sign is swelling, particularly in the legs, ankles, and feet, caused by fluid buildup. A rapid heart rate, too, might indicate your heart is struggling to pump blood efficiently. Some people also experience a persistent cough or wheezing, often producing white or pink mucus, a result of fluid buildup in the lungs. Lastly, a decreased appetite or nausea might occur, as digestive issues can arise from congestive heart failure. Remember, these symptoms can vary greatly based on the severity of the condition and which side of the heart is affected. Knowing the symptoms is the first step towards managing this condition. But how do we treat it? While congestive heart failure is a serious condition, there are ways to manage it. Let's shed some light on them. Treatment of congestive heart failure often involves a combination of lifestyle modifications, medications, and in severe cases, surgery or devices to help the heart function better. Lifestyle modifications can include a healthy diet, regular exercise, and reducing sodium intake. It's about embracing a heart-healthy lifestyle. Medications may be prescribed to manage symptoms, improve heart function, and increase life expectancy. These could include beta blockers, AAC inhibitors, or diuretics. In severe cases, surgical procedures or devices like a pacemaker or defibrillator may be recommended to improve the heart's function and quality of life. Regular checkups and following your doctor's advice are crucial in managing this condition. Remember, proactive healthcare is key. With proper management, those with congestive heart failure can lead a fulfilling life. Knowledge is power, so keep learning and stay healthy.